Today we have three groups presenting to you over benefits. We have Hannah and Terry, who provide personalized retirement planning sessions to employees during one-on-one appointments. They also help employees to understand their options for retiring and all the benefits that are available to them. We have Travis Albrecht, who is a licensed pharmacist with the Know Your Rx Coalition. He's been a pharmacist with the coalition since 2015. And prior to this, he was a staff pharmacist for the Kentucky Clinic Outpatient Pharmacy. He enjoys speaking with the patients and helping them to understand their medications, both the pharmaceutical logic behind each prescription, as well as how the patient can save money by switching to safe, effective, and cheaper alternatives. And finally, we have Chris Tyler, who is with United Healthcare, our Medicare Advantage vendor. He's worked as a client service manager for multiple government retirement systems, universities, and state health plans since joining United Healthcare in 2014. He has also served as a benefits consultant during plan implementations and has traveled extensively as lead presenter during retiree open enrollment meetings. So give it up for Terry and Hannah.
Well, thanks for being here today. I'm Terry. Hannah, my colleague over there. We are the retirement officers and benefits, and we're the ones you're going to contact when you're ready to retire. We want to meet with you. We want you to understand your benefits thoroughly. It's a personalized meeting based on, when you were hired and what you would be paying for your benefits. So we will help you be your best friend throughout that process. So what we're going to cover with you today, we're going to go over what everybody receives from UK if you retire, what you need to know to retire. We're going to cover what's early retirement, normal retirement, and even phased retirement. We're going to give you a summary of the health plans if you're under 65, what those would look like, and if you're 65 plus. And some retirees do retire, but they come back to work through steps and in a post-retirement position. So we'll look at what that might look like. We're going to cover the Medicare Advantage plan for those 65 plus, as well as the prescription benefit. So what do you receive as a retiree from UK? And there's quite a bit. Free consultations. You heard from Todd McCauley today. He is our certified financial planner and benefits. You can have up to 5 free sessions with him. Counseling from Fidelity and TIAA. You can always go to them as your retirement carrier for license with investment advice about your retirement portfolio. We have a great benefit within benefits, Know Your Rx Coalition, and we have our speaker here today is going to talk about the Express Scripts and the services that you can get through their benefit. Through the Work Life Office, we have a fantastic elder care program, and this is an elder care specialist. So if you are a caregiver to someone who's older, or maybe sometime in your retirement years you need care for yourself, you can actually talk to an expert that understands programs, resources in communities, not necessarily right here in Lexington, but that can be anywhere in the country. A mental health therapist. You met one today, Ann Bissoni. She's a licensed clinical social worker, and she could provide counseling for a variety of mental health issues when you are a retiree. Through the wellness program, a dietitian, and more. We have a lot of fun opportunities for retirees. Fitness membership through the wellness program. And the wellness program has a lot of other opportunities for you as a retiree to be engaged and be part of the university and their wellness offerings. Through the benefits office, we have a retiree fair each year in the fall, and this is a great social event. It's amazing to see our retirees come back to this event and socialize with one another. But you're getting to learn about a lot of resources in the community that's more towards volunteering and keeping you active and engaged. To keep that lifelong learning going on, but the volunteering opportunities that are out there, it seems to attract a lot of our retirees. Activities and more from the Osher Lifelong Learning Institute. Hopefully you talked to them today. If you are 50 years old, you can start participating into their events and their programs. And then tuition-free classes from the Donovan Scholars So if you're age 65 or older, you can come back and take classes at the University of Kentucky, and it's free. Will you do early or normal retirement? First, there's no set retirement age. Early retirement is when you're not 65 years old, but you qualify, you've met that criteria, which is two things. One, your age and your years of service have to equal 75, plus you have to have 15 consecutive years of service. If you're looking to retire early, staff should give at least a 90-day notice to your department. If you are 65 and older, you can retire, and that's considered normal retirement. Now, your years of service will come into play if you have access to benefits at that point, but just being 65, you qualify for normal retirement. And if you're one that's kind of on the fence about retirement, you're not sure if you are ready quite yet, but maybe you're 3 years from retirement, you might want to look into phased retirement. It's not something that all employees are guaranteed to be able to work out with their departments, but if so, it's a nice way to ease into retirement, and we'll talk about that in a little bit. But you can qualify for phased when you're 60 years old. What's your official number of years of service? That's very important because that's going to tell you if you're eligible to retire. So, and to have an accurate understanding of your benefits and what you're entitled to, contacting Hannah or myself for that service check is going to be critical. And we encourage you to do that early rather than later. We think it's important for you to reach out when you're closer to retirement age, such as if you're within a few years of retirement being eligible. And we'll do that service check, send you a letter, and it will tell you if you're eligible, if not, when you will be. And just be patient with us if we hear from you early next week. We get a lot of PR from this retirement conference, and for the last month or so, we've been getting a whole lot of requests for these service checks. So if it's a priority, you're thinking to retire in the next 6 months or maybe earlier, just let us know so we can move you up our list and get you in sooner. So more about early retirement. You do have to meet that 75 rule, like I mentioned. Your years of service, it has to be 15 years in a continuous service in a regular position, 100% FTE. 15 years working in a full-time position at 100% is going to equal 20 years working in a position classified at 75%. So that's important for you to know because, like in the hospitals, a lot of nurses that we talk to, they work 0.9. So we're prorating those years of service to determine when you would, what your years of service is and when you would be eligible. And those years are continuous with no interruptions, and those years are in a regular position. So temporary, on-call type positions would not count for retirement purposes. More about phased retirement. So if you're going on a phased retirement, you're not retiring yet. You're still an active employee. I like to look at it as you're easing into retirement. If your department approves a phase for you, it could be up to 3 years. When you're on a phased retirement, you have to reduce your FTE, and that can be at least half-time, but no more than 80%. So no less than 50%. So that's your range between 50 and 80% on a phased retirement. You get the same insurance as full-time employees. Your retirement savings continues. You still, it's going to be prorated based on your FTE, but you still get the 200% employer match at that reduced salary. One of the benefits of phased retirement, if you do need to access your retirement funds, you can do that. You just need to let us know in benefits, because there's some things we have to do on the back end, and maybe one of the companies has a form you have to fill out. So we can help you with that. You just need to let us know in advance so we can make that happen for you. And one important thing we want you to know about phased retirement: it's not a guaranteed benefit for all employees. It's really subject to your department being able to support a phased agreement. So the conversation starts with your department. Talk with them to see if it's something that would work for them as well as you. And then if it's something that's doable, you can go to our benefits page. We have a retirement link and a phased retirement section, and you can actually print off the document that you need to fill out with your department. Once that's all completed, you can then work with us in benefits, because we can certainly help you get the approvals in place, because there's quite a bit of approvals that go along with these agreements. Unused sick leave can be converted if you have 66 days. If you were hired prior to July 1 of 95, then you can convert your unused leave for a financial payout. How that works is you get 22 days of your hourly rate, and then the remaining hours you get paid at 10%. Or you can move up your retirement date. So if you're not eligible to retire yet, but let's say you have your 66 days and you have 3 months there before you're eligible, you can use those days to move up so you can retire early. If you were hired on or after July 1 of 95, you can convert your unused leave and move up your retirement date, like I just stated, or you can add it to your years of service. So what I mean by when you add it to your years of service, you're eligible to retire, but if you're in that age service matrix and have, let's say, an example, you have 24 years of service, 9 months. You're 3 months from having your 25 plus years, which would lower your health insurance cost. So you can use those sick time to add to your 24 years of service to get you to the 25-year mark, and that would save you money. When you have a benefits meeting with Hannah or I, we're going to estimate these payouts for you and look at your sick leave to see if there is something that you could do with that could potentially save you money. Vacation leave: anyone with a vacation leave balance up to a year's accrual will receive a payout for that. Payouts from your vacation and or sick leave can be tax sheltered, and you can put that into one of your voluntary retirement savings plan. And that's something you need to talk with Hannah or I if that's something you want to do. So when we have a benefits meeting with you, not only are we going to estimate what that payout's going to look like, we'll give you that information that you can take back to your tax planner or your CPA. You might have a financial planner that you work with. I know that often our retirees will meet with TIAA and Fidelity and get their 2 cents on what to do with the extra funds to help save them on state and federal taxes. Your health insurance, that's what we're going to get in next, is the health insurance and what it might cost for you. That's going to be based on a lot of factors, and this is where a lot of people get confused, and really why it's helpful, I think, to come in for benefits meetings for this reason. So we can look at your hire date. We're going to also look at your years of service. We're going to look at the date that you became eligible to retire, and that age comes into play there as well. And we're also going to look at whether or not you have a goal of coming back to work at the university through STEPS or in a post-retirement position, because that can also have an impact on what your cost is going to be for your health insurance. And now I'm going to pass it over to Hannah. She's going to get more into what the costs will be for the insurance.
Hi, everyone. So you're under the age of 65. It's going to be the same health plans that you have now. So the same HMO, PPO, RHP, EPO. We do not offer the HSA or the high deductible plan as a retiree. And cost is differed based on your hire date and the date you became eligible to retire. If you're age 65 or older, we do offer our Medicare Advantage plan. This offers complete freedom to receive services from any provider who accepts Medicare. And then our other costs would be if you're a retiree actively working at UK at any age, you will receive a reduced cost for at least 1 year. So for those rates, you can go on our website. So that's uky.edu/HR/benefits, and you can pull up our retiree booklet, as well as we have a tab that has all health insurance costs. As a retiree, you will receive a booklet every year during open enrollment for any new rates or changes that may occur. So under the age of 65, here are your health rates if you became eligible to retire prior to July 1 of 2007. So for those rates, you can see a range between, for instance, HMO and PPO is $84 up to $1,334. That is for a family plan. So if you're just covering yourself and you were eligible to retire prior to July 1st of 2007, it would be the cost for your health insurance would be $84 a month. If you're adding a spouses or dependents, you do not receive a health credit. Spouse and dependents do not receive a health credit during retirement. If you were hired on or after January 1 of 2006, you will not receive a health credit. So that cost is $836 a month for just yourself, up to a max of $2,086 for your family. So Terry mentioned earlier our age service matrix. So this is if you were hired prior to January 1 of 2006, but eligible to retire after July 1st of 2007. So if you're under the age of 60 and you have your 25 plus years of service, that cost is $334 a month. So based on her example earlier, you were close to that 25-year mark and you were under the age of 60, you'd be paying $502 a month. But if you use that sick time to move up your 25 years of service, now you're paying $334 a month. To add a child or children, it is an additional $416 a month. Spouses is an additional $835 a month, and if you add the family, it's an additional $1,250 per month. And then as you can see, at age 65, you're going to go on to a different plan. Yeah.
So on like the PPO or the UK HMO, the single range was like 84.
If you were eligible prior to July 1 of 2007, then you would fall on these rates here. So it'd be $84 a month for just yourself. Yes. But the other one is if you're eligible to retire after, but hired before January 1 of 2006. I know, lots of dates.
But the spouse information is the same?
The spouse is the same. You do not receive a health credit. Yes. So the spouse would be an addition, instead of the $84, it'd be $84 plus $835. Yes. So y'all have heard Medicare a lot today, but let's go over it again because it doesn't hurt to hear it multiple times because Medicare is very complicated. So there are 4 parts to Medicare that you need. Medicare Part A is your hospital insurance. If you are still working, we suggest enrolling in Medicare Part A only. If you are no longer working, you will need to sign up for A and B. So if you're still working, A only. When it comes to B, when you retire, either myself or Terry will help you enroll so you're not penalized. Yes, ma'am. You won't go on Medicare if you're still working. We suggest the Part A because it'll help you later on enrolling in Medicare Part B. And if you have the PPO plan, then it could potentially pick up some of the co-insurance. if you have the Medicare Part A. Huh? If you're over 65 and still working, we suggest enrolling in Medicare Part A. Do not enroll in Medicare Part B. In A? So her question is whether or not she should enroll in Medicare Part A if you're still working. It just helps later on whenever you're enrolling in Medicare Part B that you're already in the system, so you can get your card for Part B faster. And if you are still working and you have A and you maybe have the PPO plan, it could potentially pick up some of the co-insurance. It's for hospital only, so not medical. So not at the doctor office. Part C and D is our Medicare Advantage plan. So you need A and B as well as C and D. So if you are eligible for the Medicare Advantage plan, it covers Part C and D. D is your prescriptions, so D for drugs. Easier to remember that way. So Medicare Part A and B is required by the government when you are no longer working. There is a premium to Part B, and Russ Russell mentioned those premiums earlier. And you may have to pay a premium for Part D. It is based on your modified adjusted growth income 2 years prior to either when you turn 65 or whenever you retire, whichever one is the latter. On Medicare Part B, it covers 80% of your medical costs, so that's why you need that a supplement to cover the additional 20. UK offers the Medicare Advantage plan, and if you are eligible, please to determine if you are eligible, please contact either myself or Terry, and we can go over those rates with you. So age 65 plus, you'll go onto our Medicare Advantage plan. So when you are no longer working and you're over the age of 65, this is the only plan we offer. You will not be on the HMO, PPO, RHP, EPO. It's just the Medicare Advantage plan. So if you were hired after January 1 of 2006, you have 5+ years of service, you will not receive a health credit, but you do have access to our plan. So just for yourself, and these are for 2020 rates. So Medicare falls on a calendar year, so January through December. Now your dental and your vision will still remain on a fiscal year, so July through June 30th. So if you're just covering yourself for retiree only, it would be $186 a month plus your Medicare Part B premium. If you have a spouse on the plan, it's $372. And if something were to happen to you, we do not drop the spouse, and your spouse can continue on our plan. So if you were hired before January 1 of 2006 and you have your 15+ years of continuous service, you are eligible for a health credit. For that credit, just for retiree only, it is $19 a month. If you add a spouse, it's $205 a month, again, because spouse do not receive a credit during retirement. But if something were to happen to you and your spouse is still on the plan and you received a credit at the time of retirement, your spouse will get a credit on this plan, and it's $102 per month, in addition to the Medicare Part B premium. So what do you need to know about billing when you have the UK plus the Medicare Advantage plan? So UK Medicare Advantage plan is your health insurance. When you go to the doctor, you will only show them your United Healthcare card. That's who we have for our Medicare Advantage plan. There is a deductible, and it's the Part B deductible. As of 2019, it's $185 on a calendar year. Claims are handled by United Healthcare. Once you have met that deductible, your out-of-pocket is just 4%. So you won't have any co-payments on this plan unless you're on an ER or an urgent care. So when you go to the doctor, you'll never pay anything up front unless you're in the ER or an urgent care. You'll be billed later on. So you owe those remaining charges of that 4%. There is a max out-of-pocket of $3,000 per member. So if you add the spouse onto it, there is a family. So it's $6,000 for the family. I did speak to a lot of people that may have children on the plan. If that's the case, they will stay on the HMO PPO plan that you're currently on, and that cost is $416 a month. So are you considering coming back to work as a working retiree? You may be eligible for reduced health insurance. So you must be in a temporary, non-benefits eligible position, so a STEPS or a post-retirement position. You must work a minimum of 20% FTE or full-time equivalent or greater. So if you return to work no later than 3 months after your retirement date, you can keep the same employee rate or employee insurance plan and rate for 1 year from your retirement. If you come back 3 months after your retirement date, you could get our reduced cost for our working retirees and dependents if you received a health credit at the time of retirement. If you're age 65 or older, you must switch back to either the HMO or PPO. But if you're coming back to work immediately after retiring, you would not have to go on to Medicare. So for those working retiree rates, if after for 1 year, as long as you come back within 3 months of retiring, you get the same employee rate for 1 year. So that's for you as well as your dependents. So if you have the spouse on it, it'd be the $265. If it's yourself, it's $33 a month. If you are hired before January 1 of 2006 and received that health credit at the time of retirement, for the HMO and PPO, if you're working a minimum of 20%, it's just $33 a month that you're paying now as an employee. Again, dependents do not receive a health credit at the time of retirement. So if you're covering the family, it's $849 a month for the HMO or PPO plans. If you are eligible or hired after January 1 of 2006, you will not receive a health credit, but you can still remain on the HMO plans. And that cost is, for the HMO PPO, is $546 a month. If you have the RHP, it's $550, or if you have the EPO, $750 per month, if that's just covering yourself. So it is a lot less expensive coming back to work than retiring completely under the age of 65. When you retire completely under the age of 65 and hired after January 1 of 2006, the cost is $835 a month. So here's some contact information. You can contact our customer service at a number there, or you can email Terry and myself at the retirement@uky.edu email. Terry and myself check this probably hourly, so we get back to you as soon as we can. When it comes to billing, Kara Tackett, who introduced Terry and myself earlier, she will actually be handling your billing. And if you have any medical claims, Debbie Martin is our benefits advocate. All right. Thank you so much. Now we're going to go over to Travis for your Know Your RX.
Good afternoon. My name's Travis, as was introduced earlier. A pharmacist with the Prescription Benefits Department here at the University of Kentucky with the Know Your RX Coalition. I went to all my undergrad at UK, graduate school at UK. So if there's any lecturers or professors here, your wish has come true. One of your former students has to give a lecture Friday afternoon, the day before a home football game. So I will do my best to keep you entertained, but most importantly, give you information that you're going to need as you move on into retirement. So it's a wonderful journey. We're going to go over, as we've been kind of, it seems like everything's been going over, pre-65 retirees, what you're eligible for, what you have, as well as when you retire and you turn 65. She just kind of went over this as far as what makes you a Medicare retiree. You're over 65. You work less or more than 0.2 FTEs. Then you kind of stay in that HMO plan or PPO. On the commercial side, Medicare retirees, you can still be working, but you just have to be under that 0.2. So for everybody who retires before they turn 65 and are not Medicare eligible, it's that same commercial plan that you currently have. You'll have one card for yourself and your dependents. That information will not change. The copay structure that you're in does not change. Everything's going to remain the same from the current plan you have as an active employee as you do as a pre-65 retiree. You're all covered under the same ID number as far as that goes. The plan is administered by Express Scripts, and UK does direct access and enrollment. So if there's ever a problem with your prescriptions at the pharmacy, if you're needing somebody enrolled or anything like that, you can call our office directly and we can take care of the issue. Because it is an access level and enrollment level at UK, we can make sure coverage is appropriate. We can make those changes pretty quickly and get those done instantaneously. That's a big difference from the Medicare side, which I'll go over here in a second. So it is kind of an in-house setup where we have access and we can manage things. On the Medicare side, there's no dependence. And when I say that, if you and your spouse are both on Medicare, you're both going to have your own Medicare card. It's not going to look like she's under your plan or you're under her plan. You each have your own individual Medicare Part D card and your Part D plan. This is all administered by Express Scripts, and enrollment is through CMS, so for Center for Medicare and Medicaid Services. And enrollment comes from UK. They get their eligibility file to Express Scripts. They send it to CMS when everything gets approved, and then enrollment happens. So if there's an enrollment issue on the Medicare side, we can't fix it as quickly. We can definitely assist, make sure all the T's are crossed and I's are dotted, but it's not an instant fix as on the commercial side. Moving on, this is kind of what the copay structure that you have right now versus the Medicare plan. You can see there are a few changes. Some of the biggest changes you'll see are at the commercial plan, you're limited to a 30-day supply at your retail pharmacies. You can get 90-day supply at Express Scripts Home Delivery, and you get 90-day supply at Kentucky Clinic Pharmacy. Those are the only two places you can get that 90-day supply. Conversely to that, a Medicare plan, you're allowed to get 90-day supply outside of UK and outside of Express Scripts. I'll dive a little bit more into that here in a little bit, but that's one of the big differences. Another one is the Medicare formulary is a closed formulary. So there's medications fall as either generic, formulary brand, non-preferred drug, and then non-formulary, not covered. We do our best as the coalition to reach out to patients. If we have access to your claims, as we do, all patients moving from the commercial plan to the Medicare plan, we will be doing outreach when we get files that patients are moving over to call them, give them a heads up. Ms. Jones, your drug XYZ is going to be not covered, or there's going to be a change in cost. We'd like to help you out, address any issues you may have, try to get things squared away. So you don't go to the pharmacy November 1st and have a big problem. So if you see a phone call from UK Benefits coming across your caller ID, try to answer it. We're trying to be helpful on the other end. One big thing to notice as well is the Medicare retiree copay structure for generic medications. There's no minimum. Oftentimes when patients move over to the Medicare plan, some of their drug prices actually go down because there's no minimum. They just pay a 20% cost on the drug. If the drug's $10, they don't pay that minimum $8. They pay 20%, so they pay $2 for that drug. Some of the operational differences, like I said earlier, 90-day supply is only available UK, Express Scripts, mail order. You can now get 90-day supply through Walgreens as well, UK and Express Scripts Home Delivery. Specialty medications, you're able to get those at any pharmacy. You're not limited to just UK or the mail order or Credo pharmacy. Healthcare reform, ACA. What that's done for a lot of plans as far as $0 copay on oral contraceptives or vaccines, that's no longer applicable to Medicare. None of the ACA rules that we live by in the commercial world apply to the Medicare world. So that's one thing to keep in mind when we're looking at maybe before you retire, go ahead and get your Shingrix, your shingles vaccine, while it's still going to be a $0 cost to you. Kind of a few things to look at. Pharmacy copay cards. Those are not eligible on a Medicare plan. So that copay card that brings your Crestor down to $5 or Lipitor. Both of those are available generically now, but those copay cards are no longer eligible to help reduce the cost. We have some slides here in a little bit that show where pharma contributes to your drug cost, but part of the legislation and part of just the rules of Medicare is those cannot be used. So oftentimes patients are unaware, they get an expensive drug, look for a copay card, and then find out they can't use it. The UK pharmacy discount, if you're not aware of this, it's a pretty good deal. If you're on the commercial plan and you have a prescription written by a UK prescriber and it goes through on the UK benefit, you get 50% off that drug if you fill it at Kentucky Clinic Pharmacy, up to $60 off. It's a huge benefit. A lot of patients are taking advantage of it. It's really driven down costs to make medications that were borderline affordable very affordable for patients. And as I alluded to earlier, the formulary on the active plan it's an open formulary. So if something's non-preferred, it's a 50% cost, whereas in the Medicare plan, if it's not formulary, it's just not covered, and you're subject to the cash price of it. Some more differences as far as what's covered on what side of the benefit. Diabetic testing supplies, currently covered on the prescription benefit. Moving over, it's going to be covered on your United Healthcare card. If you're in the Medicare plan, it's that United Healthcare Medicare Advantage plan, and that's what you'll show at the pharmacy as opposed to your Express Scripts Medicare Part D card. Nebulizer solutions, kind of same situation. Some oral anti-cancer medications. Xeloda is one that comes to mind. It moves from prescription benefit to a Medicare Part B covered product. Flu, vaccine, hepatitis B has been making, or hepatitis A vaccines have been making a comeback here recently with all the news and everything. Those are right now, currently, depending on if you're the HMO, PPO, it can be doctor's office or pharmacy. But when you move into Medicare, they're all covered on the United Healthcare side of the benefit, as well as most other vaccines, Pneumovax, shingles, and things like that. Vitamins and minerals are currently selectively covered on the commercial benefit. They're just not covered on Medicare. The same as cough and cold medications. So your expectorants, Tessalon pearls, those are all not covered on Medicare. It's kind of just a Medicare rules that we have to follow to offer a Medicare plan is cough and cold medications are not covered. So on the Part D, oh, I'm sorry. Go back. Correct, yeah, so this is a Medicare Part D plan. It is subject to all, as I alluded to a second ago, it's subject to all the same rules that Medicare applies. And we have to follow those rules in order to offer that Medicare Advantage plan. This is a big slide with a lot of things going on. This is the standard Medicare benefit that's offered. If you're going to offer a Medicare Advantage plan, as UK does, the rules are it has to be actuarially better or equal to this. Some of the differences between the UK Part D benefit plan that's offered is that bottom half, that $415 deductible, is non-existent. You do not have a deductible on the prescription side of the UK Medicare Part D benefit. You go straight into that copay structure, which previously was, depending on generics, brands, non-preferreds, starts at 20%. So it starts off with no deductible and partially better than the partial coverage, 20% as opposed to the standard 25. There's a coverage gap, and it's commonly referred to as the donut hole. People here talk about that. I fell into the donut hole. I can't afford my medications. UK covers the donut hole effectively for you, so you see no change in your copay. If you're paying 20% and you fall in, when you get to that donut hole, you continue to pay that 20%. You don't have any sort of change in experience at the pharmacy. And when I was talking earlier about pharma copay cards not being applicable in the Medicare plan, is because this is where, in the coverage gap, pharmacy copay cards come into play. Pharma contributes, in 2019, if you have a brand name drug and you're in the coverage gap, they contribute 70% of the drug cost towards your copay. This comes into play when we look at accumulators like maximum out of pocket, your total drug cost, and things like that. Your copay accumulators, you actually get credit for that 70%. Even though you're not paying it, you get credit for it towards your total out of pocket, so you can move faster into the catastrophic coverage. I'm sure there's no questions about this at all, Ryan. This is the 2020 slide as numbers have changed. Effectively, the coverage gap will be eliminated with all of the healthcare reform and everything. That's one thing that has affected Medicare, is they're trying to eliminate the entire coverage gap. But looking more at the numbers for 2020, because I'm sure people are more interested in those than they are what's going on now. As you can see, generic drugs and brand name drugs accumulate at different rates for you as far as your buckets of money, how much you have paid versus how much you're getting credit for, and then that determines what your copay is. And it really doesn't affect you because UK covers that coverage gap until you get to catastrophic coverage. And once you get to catastrophic coverage, your copay for medications moves down to 5%. So it's proportional to the more drug spend you have, you get to that relief kind of stage faster. And if you ever have any questions about this, you can feel free to give me a call in my office anytime. Our contact information will be on the very last end of it. So just questions about how things accumulate and where they go, because that's a lot of information to look at once. As I said, there's no deductible, complete coverage through the Medicare gap. The coverage gap is when your total drug spend is equal to, in 2020, $4,020. So that counts what you pay and what UK pays. So it's the total drug cost. So it may not be what your out-of-pocket costs are, but what the total drug costs that have been spent. And then catastrophic coverage begins for 2020 at $6,350. And those dollars between $6,350 and $4,020 can contain those pharma 70% coinsurance that you're not paying, but you're getting credit for it. That's your true out-of-pocket. This is kind of an example of what that looks like. So in the initial coverage phase, if the drug was $3,000 and your copay was $60, pharma contributed $0, your true out-of-pocket was $60. Now you're in the coverage gap, $3,000, you pay $60, pharma pays 70%, $2,100, you get credit for $2,160, moving you further up the chain. So that's kind of a benefit of having coverage through the gap with the added benefit of UK. Sign up for Medicare Parts A and B the months of your 3 months before your 65th birthday. Should say 3 months before your 65th birthday. If you're in retirement. If you're still working, just sign up for Medicare Part A. As she stated earlier, you want to sign up for that, have it. It's free. It's there to help out with hospitalization if you need it. It's not a bad idea to sign up for it. You can complete UK Medicare Advantage and prescription enrollment with UK Human Resources Benefits. UK sends a file to Express Scripts, communicates with CMS, and they do all the processing, make sure that you're active, make sure that you're eligible, make sure that everything's good to go. This process does take about 90 days. So when you're looking at going into Medicare, we highly advise people to start this about 3 months out. When CMS approves everything, they send the file back to Express Scripts of who has coverage, who does not, and we send a letter with a welcome packet to every new enrollee. After 2018, they changed everything at CMS, so your ID will no longer be your Social Security number. It'll be a random generated Medicare beneficiary ID number. One thing you'll be getting in the mail, and you may want to elect to get these electronically. They're usually about 11 pages. They make about as much sense as that graph I showed earlier. And it's an explanation of your benefits that you've had for that month, everything that you would need to know for your Medicare spend. Many patients use them, find them useful around tax time. when you're filing your taxes and everything. So just know that you can elect to get those online, save your post office workers back a little bit, and you can pull them up anytime. They're right there at your fingertips. One thing is a Medicare D, it's an LEP. It's a late enrollment penalty. This occurs when you are eligible for Medicare, but you do not have Medicare coverage, nor do you have any other coverage. You pay 1% of the standard monthly Medicare premium every month added to your thing. So 1% of $32.74, $3.28 about, which isn't that bad. But if you start that at 65 and you live to 90, those $3.25 a month adds up. Maybe you went 10 years where you were eligible and you didn't have coverage. It's 120. So getting on top of this is important. You'll receive a letter from Express Scripts if you do have a late enrollment penalty. And what you can do is address that with, if you didn't have coverage through UK before, maybe it was through a spouse or something, and you need to present documentation or produce documentation that you had credible coverage leading up to being on Medicare. If you work at UK and you have the UK insurance plan, we do that for you. It's not something you need to worry about. So if you're 75 and working, and then you get this letter saying, hey, you have 10 years of Medicare, you should have been enrolled, here's your late enrollment penalty, we'll perform that late enrollment penalty attestation letter is what it's called, if you ever hear that word floating around. Another side of that is IRMA, which is income-related monthly adjustment amounts. This is if you make more than a certain amount of money in retirement every month, then your Medicare Part D premium will be adjusted up. The numbers on there are for 2020. They can increase. Every year they update these numbers, but this is something to look at. Keep in mind when you are looking at your premiums and everything is how much money am I making in retirement? Will that affect how much my premiums increase? The opposite side of that is the low income subsidy. So if you qualify, I think it's $18,735 in yearly income, a little higher for married couples, and $14,000 in resources. You can apply for low income subsidy where your premiums are lowered, subsidized to help offset the cost of Medicare for you. So those are kind of two opposite ends of the spectrum that you can be aware of. One last thing I want to touch on, when you go into Medicare, we get these claims every week. They come across my desk as far as self-administered drugs at the hospital. If you go to the hospital and you're a Medicare patient and you're not technically admitted, if you're under observation, this is something it's completely inconsequential of any sort of laws. I think it was just honestly just an oversight in how they do your paperwork or enroll you into the hospital. But if you're under observation and not admitted, Medicare B does not cover any of your drugs that you take. So if you're there and you're in the hospital, yes, you need your hypertension medication or anything like that. But maybe you could go a day, probably be okay a day without your Lipitor, your cholesterol medication, your allergy pill. Because what they do is they administer you that from the hospital. You can't bring your own medications in. And those drugs are highly inflated when they're dispensed from the hospital. So you're stuck with that bill. We can help get those bills submitted to Medicare D for you so you can get reimbursement. But it's far lower than what the actual reimbursement is. So it's just one thing to keep in mind when you go to the hospital. If you ever have any questions about that, or if you ever get a self-administered drug cost from the hospital, give me a call. We're here to help get those forms submitted for you. Here's all of our contact information. We're in the office Monday through Friday, 8 to 6 p.m. We have phones, fax machine. You can email us. You can call. Phone rings. It says if you press 1 to leave a voicemail, or if you just let it ring, somebody will pick up the phone. You can talk with a pharmacist right away, have any questions about drugs, drug interactions, medication cost, what your experience would look like if you moved onto the Medicare plan next week. We could tell you what things would need to be addressed or anything like that. So thank you so much for your time, and you guys enjoy the rest of your Friday.
My name is Chris Tyler. I am with United Healthcare, and I'm here today to talk to you about the United Healthcare PPO Medicare Advantage that's offered to you as a retiree of the retiree of the University of Kentucky. So what we're going to do today is we're going to just go real quickly over how your Medicare Part C, your Medicare Advantage plan works. And the first thing I want to address is the fact that this is a plan that is going to take the place of Medicare for you. So you will have your Medicare Part A, and you will need to enroll with your Medicare Part B, but those aren't going to make the payments for you. All of your payments are actually going to come directly from United Healthcare. So not only are we going to make the payments for Medicare Part A and Medicare Part B, but there's going to be additional benefits and programs and other features that are added to the plan as well. So you're going to have additional things that are going to be offered beyond what you would see under what we call original Medicare, Medicare Part A and Part B. So this plan is a PPO, and it does have a network of doctors on it, but it will give you the coverage for your doctor visits, clinics, hospital visits, all of that within the plan, but it also is going to give you an additional option to go outside of the network as well for the same costs that you would have within that network. Now, we don't have a premium that we charge for this particular plan to the university, but you will also have additional coverage for things that Medicare doesn't cover, such as acupuncture, routine podiatry services, such as having hammer toe treated or any sort of toenail clippings for diabetics. Also, eye refractions and reimbursements for hearing aids are also on the plan as well. Now, for those of whom who are on the HMO today, you may have to have a referral for some of your services, but we don't have that on our plan. You can go ahead and self-refer to see a specialist for any of the care that you would need on our plan. Now, as I had mentioned before, this does have a network of doctors. This is a traditional PPO plan. However, I had also mentioned the fact that you can still see doctors outside of the network at no additional cost. So the one thing that you're going to want to do is see a doctor, a specialist, go to a hospital or clinic that is a Medicare doctor or a Medicare clinic. If they are not a Medicare doctor, then they can actually bill you above what Medicare would allow them to normally take. That's the important part of making sure that they are a Medicare provider, so that way you don't end up being on the hook for some additional costs that you wouldn't have to pay had you seen a doctor that is Medicare. Now, if you want to utilize one of our network providers to make sure that that they see you when you go in for your service, you can check our provider listing at uhcretiree.com/UKY, or you can always give us a call at the number on the booklets that we send or on the back of your ID card. But then again, if you want to see a doctor outside of the network, and if they happen to tell you that they don't take our plan, that you would need to see a network doctor, please give us a call. Let us get in touch with them so that way we can explain how the plan works. A lot of times doctors that would tell you that they won't take the plan, they just don't understand exactly what we're going to pay and that you will end up paying the same thing as well. Because they think that they're doing you a favor by making sure that you're not going to pay something more, and they don't understand that you're going to get the exact same benefit going to them that you would by seeing a network provider. Now, as I had mentioned before, we don't charge a premium, so you will never receive any sort of premium notice from us. Also, there is a $185 deductible on our plan. That's the same deductible that Hannah had just mentioned a moment ago. This will be the deductible going into 2020 as well. Now, there is a $3,000 maximum out-of-pocket for each person on the plan. This right here is a safety net for you to make sure that you don't spend all of the money that you've got saved up in 1 year for any of your medical needs. So once you would have your maximum out-of-pocket met by spending that $3,000, we will begin paying for all of your medical care for the rest of that plan year at 100%. So keep in mind, this is not an amount that you are required to pay, but should you reach this amount, we'll pay the rest of your care at 100% until the next plan year. We also are going to have the majority of your costs on this plan covered at a 4% coinsurance after that deductible. So anytime you see a primary care physician or you go to a specialist office, you're going to pay 4% for that. Now, that's not 4% of what they charge. That's actually 4% of the Medicare allowed amount. So should the doctor charge $100 for a primary care visit, that amount that Medicare would allow them to accept may be less than that, and that's the 4% that you would be paying, not their actual charge amount. Now, an urgent care visit would be a $65 copayment, and an emergency room visit would have a $100 copayment. And again, your inpatient hospital and your outpatient surgery costs are, again, going to be the 4% of the Medicare allowed amount. Now, we also cover preventive care services on our plan as well. All of your preventive care is going to be covered at $0 out of your pocket, and that's regardless as to whether you've met your deductible or whether you have not. What I've got on the slide right here is just a few of the different services that we cover as preventive services, such as a routine physical, an annual wellness exam, any sort of immunizations, breast cancer, colon cancer, but there are a lot of other ones that are also covered under the plan as well. Now, there are other services that we cover with specialty providers as well, such as podiatry service, chiropractic care, vision services, and hearing services. And as I had mentioned before, all of these are covered at a 4% coinsurance, whether you utilize a United Healthcare contracted provider or whether you go outside of the network. Now I'd like to discuss just a few of the additional added programs and features that we've got on our plan as well. And the first one I'd like to touch on is our house calls visit. If you're anything like me and you go and you make an appointment with your doctor, you're lucky to get about 15 minutes of their time before they go out of the room, and in comes the nurse to take you up to the front, and then you end up showing your ID card and any sort of return paperwork that you've got. The house calls program is going to give you an opportunity to sit down with a nurse practitioner that's employed by United Healthcare and have a full review of your health history, go over any sort of medications, and doing a full health screening with you. They're going to sit down and give you about 45 minutes, maybe up to an hour of time to go over any of the questions that you may have about your health and any other conditions that you've got questions about. This isn't meant to replace your doctor. This is actually meant to supplement and give you the additional information that you don't always get at the doctor's office because they've got so many patients that they're seeing. After you complete a house calls visit, we're going to send you some notes on the visit, and we're also going to share that with your primary care physician as well. And through this, we can also refer you to any of our other clinical programs that you may be able to benefit from, so that way you're getting the most out of your plan with United Healthcare. Another thing that I would like to point out is our Renew program. Renew is one of our wellness programs that gives you access to all sorts of different health articles and videos. We're going to send you three different magazines throughout the year that's also going to give you different tips and articles on healthy eating and healthy living. We're going to give you recipes for healthy eating and give you other opportunities to go and log in and utilize our information, so that way you are able to really connect and make the most out of your plan. We also cover the annual wellness visit. This is one of the preventive visits that I had mentioned before. And an annual wellness visit is similar to what I mentioned with the house calls visit. And what you are able to do with this particular service is sit down with your doctor and really map out your health care over the next year. So if you go in for an annual physical, they're going to take some blood, they'll take your blood pressure, they'll go over what your actual vital signs are, but that's really not going to tell them exactly what it is that you're feeling, and it's really not going to also tell you what you need to set as your health goals. But this particular service is meant for that. So we cover this at 100%. You can get an opportunity to meet with your doctor and go over and map out your care for the year. So by utilizing this service and also pairing that up with the house calls service, you're able to make sure that you're getting the absolute most out of your plan and that you're well prepared for the next year. Also, with the annual wellness visit, that can earn you a reward from the Renew program. We offer rewards for certain services as well, and this is one of them that we've typically rewarded in the past. Now, I've had several people come back to my table this afternoon and ask me about gym memberships to see if there's anything that they can have on the Medicare plan where they can go and work out. And the answer to that is absolutely yes. With the Silver Sneakers program being built into our plan, you will have a free gym membership to go in and utilize their facility and any of the amenities they have. So if they happen to have a pool within the facility, you can utilize the pool. If they've got exercise classes through Silver Sneakers, you'll be able to take part in that. I've even seen some of the Silver Sneakers facilities on their website list that they've got saunas and tanning beds. Didn't think that would necessarily be something that you would get on the plan, but if it's on there, you can utilize it. So you can take your Silver Sneakers ID card that we're going to send you after you enroll in the plan and utilize that at any of the 16,000 gyms nationwide. Not just here in Lexington, but you can go on vacation, go down to Arizona, go down to Florida in the cold months, whatever it is, and also utilize the facilities there. If you're interested in seeing if a facility is near you, just log on to silversneakers.com, put in your zip code, and you'll be able to see the different facilities that are available to you. I would also like to point out that we cover virtual visits on our plan as well. A virtual visit gives you an opportunity to meet with the doctor while you're still at home. You don't even have to walk outside of your front door to get diagnosed and have prescriptions sent to your local pharmacy. A virtual visit is great for things like allergy problems, if you've got a fever, seasonal flu, any sort of migraine headaches. Recently, I had some sinus pressure that was building up, pulled out my cell phone, logged on to one of them, and saw a doctor, got the prescription sent in to my local Walgreens. I went out and got myself some lunch, picked up my medication, got right back to work. It only took me about 15 extra minutes outside of my lunch, and didn't have to miss any work to go and schedule time with the doctor. You can do the same thing if you've got a smartphone, a tablet, any sort of laptop or desktop computer that's got a camera where you can see the provider and they can see you. We also offer this for any sort of behavioral health visits, which are great for things like depression or any sort of stress or anxiety that you're needing to see a provider about. The two different networks that we utilize for this particular program are Doctor on Demand and Amwell. You can download those apps directly to your phone and enter in your United Healthcare information and go ahead and start seeing a doctor whenever you need them. We also offer you access to the United Healthcare Nurse Line as well. The United Healthcare Nurse Line gives you access to speak with one of our registered nurses 24 hours a day, 7 days a week. You can ask them any sort of questions about health conditions that you have. I know that Travis and the coalition are great about medications, but they can also answer questions about medications. I think you might get great information either way. And they can also give you any sort of information about any sort of ongoing health condition that you have or new diagnosis as well. So you can always reach out to us and speak with one of our nurses anytime that you want. The ID card that we send you will have the nurse line number on the back. I'm very happy to announce as well that with United Healthcare Hearing, you can also get access to several major manufacturers of hearing aids at discounted prices. We've got 5,000 accredited hearing providers nationwide, and with this particular program, you will have access to going in and being able to have your hearing tested, getting fitted, and getting hearing aids if you need them. We offer a hearing aid reimbursement on our plan so that you can utilize with this right here. And so you can actually have hearing aids fitted for you right there in an office, or even do this through home delivery through the mail as well. Now, lastly, just a few things I would like to discuss is just some of the additional rules around Medicare as well. Once you join our plan, of course, you have to be entitled to Medicare Part A, and you've heard it said several times today that you must continue to pay your Medicare Part B premiums. The reason we tell you this is because if you stop paying your premium for Medicare Part B, they will remove your Medicare Part B, and if that ends up happening, you would also be removed from this plan as well. It's important that you pay for your Medicare Part B on a continued basis. If you can set it up to have it be automatically deducted and sent to Social Security, I highly recommend it, so that way you never forget to pay that and inadvertently find yourself removed from the plan. Also, you can only have one Medicare Advantage plan at a time. This is the time of year where individuals on Medicare are being mailed several different things. Sometimes you're being called on the phone. There's commercials running on the television, even on the radio, telling you about the different options available to you on Medicare. By enrolling in another Medicare Advantage plan, you will be removed from your Medicare Advantage plan through the University of Kentucky. That would stand true for both our plan and also the Express Scripts plan. It would remove you from both. So by enrolling in any other Medicare Advantage or prescription drug plan, a Medicare Part D plan, it will remove you from those plans. So unless you are really wanting to find a different coverage and forego your University of Kentucky plan, I do not recommend enrolling in anything else. Also, you would not want to enroll in any Medicare supplement plan as well. If you enrolled in a supplement plan, they will only pay after Medicare Part A and Part B. When you're enrolled in our plan, we make all of your payments, and you will not have any payments made by Medicare Part A and Part B. So since that would be the case, and since supplements only pay after Medicare Part A and Part B, you would be paying a premium for a Medicare supplement plan that will pay absolutely no claims for you. So again, I would highly recommend not enrolling in a Medicare supplement plan if you are enrolled in these plans. If you have, once you enroll in this plan, we're going to send you what is known as an evidence of coverage. That is our contract with you. It's going to tell you how we are going to administer the plan and also what your rights and responsibilities are under our plan as well. It gives you all of your information that you need to know on how you can ask us to cover things or cover certain services, and also any sort of appeal or grievance rights that you have if you have any sort of issue that you may experience while being on our plan. Also, the evidence of coverage is going to discuss any sort of benefits, co-pays, exclusions, and limitations on the plan as well. So by reviewing that particular document, you will be well-versed to utilize your plan moving forward. So with that, that brings me to the end of my presentation. I'd like to thank you for allowing me to discuss the Medicare Advantage plan with you. And if you have any questions, of course, please give us a call at the number on the back of your ID card or at the materials that you're given by the University of Kentucky. Thank you for your time.
We have some time for Q&A. If you want to raise your hand, Gail, and we will try and get those questions answered. Yes. Would you mind repeating that one more time in the mic? I couldn't hear very well. I heard pieces of it.
She could
Sorry.
hear you.
I'm sorry. Last year and this, there were
Okay.
opinions that differed about whether once someone becomes 65, whether or not when they're still working at UK, whether or not they need to do Medicare A or not.
Okay. Yeah, sure.
The
that's-
Social Security representative today told me I didn't have to.
Right. We kind of caught that at the benefits table. So if you're still working, I mean, you don't have to, but we encourage you to. And there's two reasons why. One, it's going to help you get your Part B card faster, and it's less work you have to do when you are retiring, because if you're over 65, you're going to have to get Part B. Before you can get Part B, you have to have your Part A. So if you don't have that already, there's 2 steps that you're going to have to work on with Social Security, and it's going to take you longer to get your Medicare card. We also think, well, we know that if you have the PPO insurance, if you have Part A of Medicare, that's a hospital insurance. It's free to you to sign up. And if you've already missed your open enrollment window and you're still working, it's never too late to sign up for Part A. But on the PPO plan, that's going to pick up some of that deductible that you'd have if you are in a hospital. So that would help you. But we think it's to your advantage to sign up for Part A if you are still working. Because I promise you, we've retired a whole lot of people. And the ones that did not have Part A and they're retiring in 2 months, they don't always get their Medicare card in time. And then you're out of compliance with the plan that you should be on at UK. We work with you on that, but we can only work with you or give you an extension on your plan for so long before you might have a claim issue. So if you're getting close to 65 and you want to call us, we're happy to explain that a little, one-on-one with you. Yeah. It also delays, like on the Express Script side, you getting, and even on your health insurance time, you getting your packets and your cards in place when the plan needs to start. So it's really going to delay your insurance getting started when it needs to. You'll have coverage, but if you're using the insurance for any reason, that the claim may have to be resubmitted to get paid. So we want you to have your cards before the plan starts so that you don't have a claim issue or confusion going on to where it's going to take you a while to get that claim paid. It'll be less headache for you if you sign up for Part A as soon as you can. And if you don't have it now and you're over 65, you're not retiring, go ahead and sign up for it. But I should say, if you have the UK Health Savers plan, you can't have Part A, but I don't think many of us here have that because it's a new plan. Any other questions?
What about the vision and the dental and stuff? Can you tell us about that?
Yes, so she was asking about what about the vision and dental plan? That is a benefit that continues in retirement.
Same price?
It is the same price if you have Delta Dental, but if you have UK Dental, it's a completely different plan. You have more coverage than the employee plan, and the rates are higher. So that is reflected in the benefits book. We mentioned going to our benefits page. You could look at all those plans, but there's also a PDF of our retiree benefits booklet, and you could take a glance. Like if you have UK Dental, you can take a glance at what those plans are, what they cover, and compare it to Delta Dental. Mm-hmm. And the dental vision benefits are, as well as health, is extended to your spouse. Any other questions? Yes. That's a good question. I heard her. Okay, that's a good question, and we should have announced this earlier today. She was wanting to know, are the slides to this presentation available to you? I would say probably in 2 weeks. We're working with the Student Center on that. So between the Student Center and our communications team and HR, we're going to have these presentations online on our benefits page. When you get to our benefits page, go to the retirement events section, and all the sessions here except for Social Security will be online. And we will follow up with an evaluation here next week. We hope you'll get that, as well as some handouts from our luncheon speaker, Marcy, that I think would be helpful. So you're gonna get some upcoming emails from us. Okay. Yes.
So the fee that you're talking about in Plan B, the monthly payment, is that the same thing that Hannah was talking about in the advantage for retirees? Is that the same price structure we're talking about, or is it two different things?
So I think you were asking about the Medicare B premium. In order to have our Medicare Advantage plan, you have to pick up Part B. Those are 2 fees, but the Medicare B, that's all Social Security based on income. So when you apply, they're going to tell you what those premiums are going to be, because we wouldn't be able to tell you exactly, but we have that information we'll share with you. You can get that on Medicare.gov's website as well as the Social Security website. You could look at it and get an idea of maybe what you might pay for that Part B. Normally, those premiums are taken out of your Social Security checks monthly, or you owe it to them. So that's all Social Security, and that's required for anybody over 65. If you're not working and on an employer plan, you have to start paying into Medicare B. But you have to have other insurance, because Medicare alone doesn't cover everything. And that's why we have a plan for you. And an employer plan is always going to cover more, and your out-of-pocket costs should be a whole lot less with our benefits compared to other plans outside of the university. And our plan includes prescriptions.
So you're going to walk us through how to get through that maze. We do Part B first and then the healthcare plan, or at the same time, do you work us through that?
Yes. Hannah and myself, we're your resource and benefits. You're not alone in this. We're going to spell this out for you. We even write it down sometimes for our employees that we're working with, so they have it in writing of what to do step by step. We'll make sure that everything's set up before you retire, as long as you give us a good advance notice. So meet with us sooner rather than later. I mean, I always say 4 to 6 months before you want to retire is ideal for that benefit meeting. Once you get into the Medicare, things get very complex, and it's hard to remember all the things that you need to do, but that's why we're here in benefits, to help you. Any other questions? Okay, well, thank you for coming, and we'll probably be hanging around for a few minutes if you want to talk to us.